Primary immunodeficiency disorder, PID, refers to a large group of over 300 different conditions, each caused by a defect in the immune system. Because the immune system protects the body against infections, people with PID are extremely vulnerable to infectious diseases. PID results from a mutation inherited from one or both parents. It must be differentiated from secondary immunodeficiency caused by pathogens such as HIV, malnutrition, metabolic diseases, or use of multiple immunosuppressive medications. The major players of the immune system are the white blood cells. They derive from hematopoietic stem cells inside the bone marrow. Each cell has specific roles in the immune response. The immune system consists of two branches: the innate response, including phagocytes and complement proteins, and the adaptive response, including T cells and B cells. T cells are primarily responsible for cellular immunity, and B cells for antibody-mediated immunity, but there are overlaps in their functions. PID can be classified based on the immune deficiencies, which are very often severe. Because antibody production by B cells require T cell functions, T cell deficiencies often lead to multiple immunodeficiency disorders. Severe forms of PID can be apparent soon after birth or during the first year of life, while milder forms can go unnoticed until late childhood, especially adulthood. Symptoms vary among different types, but the most common sign is having frequent, recurrent, or difficulty when treating infections. The most common are respiratory, sinus, ear, and skin infections. Blood disorders or autoimmune diseases may also occur when PID is present. Timely diagnosis, especially for severe forms, is essential to survival. Patients of any age with repeated or unusual infections must be checked for PID. Low lymphocyte count may be indicative of T cell deficiency. Flow cytometry can be used to quantify specific cell types. Lymphocyte proliferation assays are used to evaluate T cell functions. Serum immunoglobulin levels are measured when B cell deficiency is suspected. Patients may be tested for their response to certain vaccine antigens, such as tetanus toxoid. Failure to produce adequate amounts of antibody against the antigen indicates antibody deficiency disorder. Neutrophil function assays, cytokine stimulation assays, and complement studies are helpful for diagnosis of innate disorders. Disorders caused by known mutations must be confirmed with DNA testing. Treatment consists of two major parts: treating, preventing infections, and boosting the immune system, or possibly fixing it. Bacterial infections are managed with aggressive antibiotic treatments. Preventative measures involve prophylactic antibiotics and vaccinations, but live vaccines must be avoided as they may cause severe diseases. Preventative measures involve prophylactic antibiotics and vaccinations, but live vaccines must be avoided as they may cause severe diseases. B cell disorders are treated with intravenous or subcutaneous immunoglobulin replacement therapy. Phagocyte disorders are managed with cytokine replacement therapy, such as interferon gamma. Bone marrow transplantation or hematopoietic stem cell transplantation may offer a permanent cure if HLA identical donors are available. Next-gen sequencing is the most accurate way to identify certain gene mutations and then create a treatment path forward and establish a better quality of life.